Fire that paramedic! Dr. Chen's voice cut through the ER like a scalpel. She's been sitting in the ambulance bay for 20 minutes doing nothing. The other attendings nodded. Another lazy paramedic wasting their time. They didn't know. They couldn't know. Sarah Martinez had been staring at her hands, those same hands that had performed emergency thoracotomies in Fallujah. That had saved 12 Delta operators in a single ambush. That was before the discharge, before the nightmares made her leave surgery, before she became invisible. Then the doors exploded open. Mass casualty! Bridge collapse! Trauma 1 now! A man stumbled through, combat fatigue soaked in blood. He locked eyes with Sarah. His face went white. Commander Martinez? Everything changed. Dr. Rebecca Walsh's voice could cut through bone. 20 minutes, Rodriguez. 20 minutes you've been sitting in that ambulance doing absolutely nothing while my ear is backing up. Emma Rodriguez kept her eyes down, hands gripping her medical bag, knuckles white. This is the third time this week, Dr. Stevens chimed in from the nurse's station. Third time she's just parked out there like she's on a coffee break. The nursing supervisor crossed her arms. I'm calling your company, Emma. This is unacceptable. We're filing a formal complaint. Emma said nothing. Her lips moved silently, counting. 1, 2, 3, 4. Breathe in. But she wasn't seeing the ER. She was seeing sand, dust, the inside of a medical tent with holes in the canvas, the smell of copper and diesel fuel, the sound of rotors and distant explosions. She was seeing Kandahar. 5, 6, 7. Breathe out. Are you even listening to me? Walsh stepped closer. I don't know what your problem is, but this ends today. You're done here. The timestamp on the wall clock read 14:37 Estonist. That's when the doors exploded open. The automatic entrance slammed against the walls. First responders flooded through like a breaking dam. Gurneys, backboards, blood, so much blood. Mass casualty, bridge collapse on Interstate 95. We've got at least 15 critical coming in, 30 plus more behind them. The triage nurse's face went pale. Dr. Walsh's head snapped around. What? How many? The overpass collapsed during rush hour. Concrete came down on at least 40 vehicles. They're still pulling people out. Chaos erupted instantly. Walsh started barking orders. Get trauma 1 and 2 open. Call surgery. I need all available staff down here now. Someone page orthopedics and neuro. Move. Victims on gurneys lined the hallways, more on the floors, paramedics shouting vital signs, nurses running in every direction, equipment carts being wheeled frantically from supply rooms. The ER descended into controlled pandemonium, except it wasn't controlled. We don't have enough chest tube trays. Trauma 2 is still occupied. Where's the rapid infuser? Emma pressed herself against the wall, invisible, the way she'd learned to be. A man stumbled through the entrance, tactical pants, torn shirt soaked through with blood, supporting another victim with one arm while his other hung limp. He was pale, breathing shallow, moving on pure adrenaline, former military. Emma could tell from 50 feet away. The man's eyes swept the chaos, trained, calculating, looking for someone in charge. His gaze locked on Emma. He stopped, dead still in the middle of the flowing trauma. Then he released the person he was supporting to a nearby nurse, straightened despite the blood pouring from his chest, brought his good hand up in a salute, his voice carried across the entire ER. Commander Rodriguez? Every head turned. Emma's face drained of color. No. The man took 2 steps toward her. Lieutenant Marcus Webb, Delta Force. She remembered his face, remembered his blood on her hands, remembered keeping him alive in a shot-up medical tent while mortars fell outside. Ma'am, you have no idea who you're talking to, Webb said to Walsh. His voice was getting weaker. This woman is... He collapsed, just dropped like someone cut his strings. Emma saw it happening, the way his hand went to his chest, the sound of air sucking through the wound. Tension pneumothorax, building pressure in his chest cavity. His lung was collapsing. Get him on a gurney, Walsh shouted. The ER residents rushed forward, but they froze when they saw the wound. Sucking chest wound, combat trauma, nothing like the car accidents and heart attacks they'd trained on. Someone get me a chest tube tray, Walsh ordered. The nearest equipment cart was 30 feet away, through a sea of gurneys and scrambling staff. Walsh started running through standard protocol. Check airway, establish IV access, get portable x-ray. Too slow, way too slow. Emma's hands started moving before her brain caught up. She pushed off the wall, walked forward, every step feeling like moving through concrete. Webb's oxygen saturation was dropping on the monitor. 88%, 85%, 82%. Walsh was calling for equipment that wasn't there yet. 79%, 76%. Emma's voice cut through the noise. Clear, authoritative, a voice she hadn't used in 4 years. "Dr. Walsh, step aside." Walsh looked up. "Excuse me?" "Step aside, now." "You're a paramedic. This patient needs—" Webb was coding. The monitor screamed, his lips turning blue. Emma moved, not thinking, not feeling, just moving. Muscle memory took over. 4 years of paralysis shattered in an instant. Her hands knew what to do even when her mind had forgotten how to let them. She ripped open Webb's shirt, buttons scattering across the floor, her hands already gloved. When had she put on gloves? 2 seconds of assessment, eyes scanning, fingers palpating, reading his body like a map she'd memorized in blood and darkness. Needle decompression, now, right side second intercostal space. A resident stammered, "We need to wait for—" Emma didn't wait. She grabbed supplies from the crash cart beside the gurney, one hand, precise. No wasted movement. Betadine swab across Webb's chest, angling 14-gauge needle perpendicular to the skin, just superior to the third rib to avoid the neurovascular bundle. Her voice was clinical, detached, the voice she'd used in the tent, in the field hospital, in the places where emotion meant death. The needle went in. There was a hiss, trapped air escaping from the pleural space. Webb's chest expanded. His oxygen saturation stopped falling, started climbing. 80%. 85%, 89%, 91%. Emma's hands secured the needle, taped it, applied an occlusive dressing. The entire ER had gone silent. Everyone staring. Emma stepped back. Her hands were shaking now, the adrenaline crashing. But the procedure was done, perfect, like she'd never stopped. Webb's eyes fluttered open. He looked at her, recognition and relief flooding his face. "Commander," he whispered. Dr. Walsh stared at Emma, then at Webb, then at the perfectly placed needle decompression. "How?" Walsh's voice was barely audible. "How the hell does a paramedic know combat field medicine?" Emma's hands were shaking violently now. She'd just performed an invasive procedure without authorization. In front of the ER chief, in front of everyone, the thing she'd been hiding for 4 years was out in the open, exposed, raw. There was no going back. Webb tried to sit up. Emma's hand on his shoulder kept him down. "Stay still, Lieutenant. You're not stable yet." "You remember me?" It wasn't a question. "I remember all of them." Walsh stepped closer. Her expression had shifted from anger to confusion to something else. Something like awe mixed with suspicion. "Someone want to tell me what's happening here?" More gurneys crashed through the doors, more victims, more blood, but everyone in the immediate area was watching Emma, waiting. The secret she'd buried was clawing its way to the surface, and there was nothing she could do to stop it. Dr. Walsh's hand shot out. "Step back, right now." Emma didn't move. "You just performed an invasive procedure without authorization, without supervision, without credentials." Walsh's voice was rising. "I could have you arrested. I should have you arrested." Webb's hand grabbed Walsh's wrist, despite his injuries, despite the needle still in his chest. His grip was iron. "Ma'am." His voice was strained but clear. "That woman has more trauma certifications than your entire staff combined." Walsh tried to pull away. "You're delirious from blood loss." She was the chief trauma surgeon for Delta Force operations, Middle East Theater. Webb's eyes never left Emma. "Commander Rodriguez saved my life in Kandahar, and she just saved it again." Walsh stared at Emma. "That's impossible. You're a paramedic." Emma said nothing, just looked at her hands. They were shaking, trembling like leaves in a hurricane, the same hands that had just moved with perfect precision. The automatic doors burst open. Again, 3 gurneys at once. "Critical trauma, Bay 1. Abdominal evisceration, we need surgery now. Pediatric multiple trauma, 8 years old, vitals dropping. The ER exploded into chaos again. Patient A on the first gurney, male, mid-30s, crushing chest injury from steering wheel impact, flail chest, multiple rib fractures moving independently with each breath, paradoxical breathing, his chest caving in when he inhaled. Patient B on the second. Female, late 20s. Metal debris had torn through her abdomen, intestines visible through the wound, blood everywhere, pressure dressing soaked through. Patient C on the third. Little girl, 8 years old, multiple injuries, unconscious, breathing shallow, only 2 trauma bays available. The ER residents looked at each other, eyes wide, out of their depth. They'd trained for this in theory, but theory and reality were different universes. "Where's Dr. Harrison?" someone shouted. "Stuck in traffic from the bridge collapse. 15 minutes out, maybe 20. Walsh tried to organize. Get patient A to trauma 1, patient B to trauma 2, patient C. But the protocols weren't working. Too many patients, too severe, too fast. Patient A's oxygen saturation dropping. 88, 85, 82. Patient B's blood pressure crashing, 90 over 60, 85 over 55. Patient C seizing on the gurney. Alarms screaming across the ER. Emma's eyes scanned all 3 patients. Combat triage, automatic, calculating survival probabilities in seconds. Who could be saved? Who needed her most? Who could wait? She stood. Walked straight to Walsh. Her voice was steady now. No shaking, just cold calculation. "Dr. Walsh, you have 2 choices. Let me work or watch them die." Walsh opened her mouth. Emma cut her off. "I've triaged 40-plus casualties simultaneously under mortar fire. This is bad, but I've seen worse, much worse." Patient. A coding. Monitor flatline. Patient B's pressure at 70 over 40. Walsh looked at the patients, at her residents, at the chaos. She made the call. "You have until Dr. Harrison arrives, but I'm watching everything." Emma nodded once. "I need 2 nurses who can follow orders without questions. Now." 2 nurses stepped forward. Veterans, the ones who'd seen everything. Emma moved, like someone flipped a switch, the paralysis gone, the fear buried, pure muscle memory and training taking over. "Patient C to trauma 1, she's salvageable but needs immediate stabilization." She pointed at the most competent-looking resident. "You, with me. I'll walk you through every step." The resident nodded, grabbed the gurney, ran. Emma turned to patient A. "Flail chest with probable tension pneumothorax developing. Get me a chest tube tray, 28, French, now." Nurse 1 already moving. Emma's hands on the patient, palpating, assessing, finding the insertion point. 5th intercostal space, mid-axillary line, betadine, lidocaine, scalpel. Her hands moved like water, smooth, certain, no hesitation. Blunt dissection. Through the intercostal muscles, avoiding the neurovascular bundle superior to each rib. She talked through every step. Teaching while saving. The chest tube went in. Perfect placement. Air and blood rushed out. The patient's chest expanded. His oxygen climbed, stabilized. Emma moved to patient B before anyone could blink. The nightmare case. Abdominal evisceration. Active bleeding. This needed surgery. Real surgery. Not just stabilization. Walsh stepped forward. "You can't do surgery here. You're a paramedic." Emma didn't look up. "Then stop me, doctor." Fresh gloves, scalpel in hand. She made the incision, clean, controlled, extending the traumatic wound to get better access. Her mind split, present and past. Then, Kandahar Province, 2019. Operating tent with canvas walls. Helicopter crash just outside the wire. 6 Delta operators critical. Blood soaking into the sand floor. She'd worked for 8 hours straight. No breaks, no stopping. Mortar rounds falling close enough to shake the tent poles. 5 operators saved. 1 lost. Captain David Martinez, her husband. She'd fought for him, opened his chest, tried everything. Massaged his heart with her own hands. It hadn't been enough. Present. Emma's hands moving with the same precision. "Massive transfusion protocol. O negative, 6 units. Now." Finding the bleeder. Right there. Intercostal vessels torn. Blood pumping with each heartbeat. Her fingers clamped. Stop the flow. Packing the wound. Temporary control. Damage control surgery. Keep them alive long enough to get to the OR. "Pressure's coming up," the nurse called out. 85 over 60, 90 over 65. Patient stabilizing. Emma worked in silence, focused, each movement economy itself. No wasted motion, no hesitation. Webb was talking. She could hear him from his gurney, telling the gathering crowd of staff, nurses, residents, attendings who'd rushed down. Commander Emma Rodriguez, MD, U.S. Army Special Operations. She performed 116 combat surgeries in theater, 94% survival rate. 2 Bronze Stars for valor, 1 Silver Star. She was supposed to be the next chief of trauma surgery at Walter Reed. Walsh's face was changing, dismissal melting into shock, shock hardening into horror. The things she'd said, the way she'd treated Emma. The other staff members stared at Emma with new eyes, but Emma wasn't listening. She was in the tent, in the sand, in the blood, trying to save David, failing, always failing. Patient B's vitals stabilized, bleeding controlled, packed and ready for transport to surgery. The little girl in Trauma 1 stable. The resident had followed Emma's instructions perfectly. All 3 patients saved. The automatic doors opened. Dr. Harrison rushed in, the attending surgeon, late 40s, 20 years of trauma experience. He took one look at the 3 patients, at the procedures, at the damage control work. Who did this work? His voice was filled with something like awe. This is exceptional damage control. Textbook, better than textbook. Everyone pointed at Emma. Emma stripped off her gloves, turned to walk out. The adrenaline was crashing now, her whole body shaking, trembling, the walls closing in. She needed air, needed space, needed to get out before she fell apart completely. Walsh blocked her path. Wait, Emma stopped. I need to understand. Walsh's voice was different now, smaller, almost afraid. Why are you working as a paramedic? Emma looked at her. 4 years of silence, 4 years of hiding, 4 years of running. And now someone was asking the question she'd never wanted to answer. The ER was silent. Everyone waiting. Emma's lips moved, but no sound came out. Not yet. Not here. She pushed past Walsh, out the doors, into the ambulance bay, where this had all started just 30 minutes ago. 30 minutes that had destroyed 4 years of carefully constructed invisibility. Behind her, she could hear Walsh giving orders, hear the patients being moved, hear Webb still talking, telling them who she'd been, not who she was, because the woman who'd saved 115 soldiers had died in Kandahar with her husband. The woman standing in this ambulance bay was just what was left, just the ghost trying to remember how to be human, and failing, always failing. Emma made it to the staff break room before her legs gave out. She collapsed into a chair, head in hands, breathing in short, sharp gasps. The door opened. Walsh entered, Webb behind her, leaning heavily on an IV pole, bandaged but mobile, against medical advice, obviously. Emma didn't look up. Commander Rodriguez. Walsh's voice was gentle now, foreign. We need to talk. Don't call me that. It's your rank. Was. Past tense. Emma's voice was hollow. I'm not that person anymore. Walsh pulled up a chair, sat directly across from Emma. Webb lowered himself carefully onto the couch, wincing. Then tell us who you are now. Emma laughed, bitter, sharp. You want the story? Fine, here's the story. She looked up, met Walsh's eyes. After David died on my table, I couldn't pick up a scalpel. The words came slowly at first, then faster. 4 years of pressure finding release. Captain David Martinez, my husband, Delta Force, helicopter crash outside Kandahar. 6 critical patients came in. I saved 5. Her hands clenched. I lost 1, and he was the only one who mattered. Walsh said nothing, just listened. PTSD diagnosis, medical discharge recommendations. Every time I closed my eyes, I saw his face. Every time I touched surgical instruments, my hands would shake. Emma held up her trembling hands. Like this, constant, uncontrollable. I couldn't operate, couldn't function. I lost my position at Walter Reed, left the Army. She took a shaky breath. I became a paramedic because I thought maybe I could stay close to medicine without operating, drive the ambulance, hand over patients, let someone else carry the weight. You were running, Webb said quietly. I was surviving. Emma's voice cracked. I thought if I could just do this one small thing, maybe I could still help. Maybe I could still matter. Walsh leaned forward. What happened in the ambulance bay earlier, before the mass casualty? Emma closed her eyes. Young soldier came in, gunshot wound, training accident. He looked like David, same age, same build, same eyes. You had a panic attack. I sat in that ambulance for 20 minutes trying not to fall apart, counting breaths, fighting flashbacks, seeing Kandahar instead of the parking lot. Emma opened her eyes, looked at Walsh. I wasn't being lazy, Dr. Walsh. I was trying not to break. Walsh's face crumbled, the professional mask completely gone, just raw human emotion. I called you lazy. I tried to fire you. I humiliated you in front of everyone. Her voice was barely a whisper. Emma, I'm so sorry. You didn't know. I should have asked, should have seen, should have been better. Webb shifted on the couch. Commander, can I tell them? Emma nodded. Too tired to fight anymore. Webb looked at Walsh. I was one of the 5 she saved in that helicopter crash. She operated on me for 3 hours with insurgents 200 meters away, worked by headlamp when the generators failed. His voice grew thick with emotion. She talked me through my fear while her hands were literally inside my chest, kept me calm, kept me alive. Commander Rodriguez is the only reason I'm alive to meet my daughter. Walsh looked between them. Your daughter? Born 6 months after I got home. She's 3 now, Sarah. Webb smiled. I was driving to her first soccer game when the bridge collapsed. He met Emma's eyes. And the person who saved my life 4 years ago just saved it again. That's not coincidence, Commander. That's fate telling you something. Emma shook her head. I can't go back to surgery. I can't. But you did today, Walsh said. Your hands didn't shake. Emma stopped, looked at her hands, realized Walsh was right. During the emergency, during the procedures, during all of it, her hands had been steady, perfect, like they used to be. When patients needed me, I didn't think. I just moved. Maybe you weren't running from surgery, Webb said. Maybe you were waiting for the right reason to come back. Emma's eyes filled with tears. First time in 4 years she'd allowed herself to cry, to feel, to consider that maybe she could be more than just broken. The door opened. A man in an expensive suit entered. Hospital administrator. Emma recognized him from staff meetings she'd sat through invisibly. Dr. Rodriguez. He used her title deliberately. I've been watching everything that happened today. Emma tensed. We need a trauma protocol overhaul. The bridge collapse showed we're not prepared for mass casualties. Our current systems failed. He sat down. Dr. Walsh recommended you design and lead the overhaul. Walsh nodded. You built systems that worked in war zones. We need that here. The administrator continued. We're offering you a hybrid position. Tactical EMS liaison and trauma surgery consultant. Ease back into surgery. Train our people in what you know. His expression was earnest. Turn our ER into what you built in combat zones, a place where everyone comes home. Emma stared at them. Walsh, Webb, the administrator, all looking at her with hope, with respect, with belief she'd lost in herself. I don't know if I can. You already did, Walsh said. Today, you saved 4 lives. No hesitation, no mistakes. That was adrenaline, crisis response. Then we'll create the right environment, support, resources, time. The administrator pulled out a folder. This is the offer. Read it. Think about it. Take all the time you need. Emma took the folder with shaking hands. I need to think. Of course, the administrator stood. But Emma, I hope you'll say yes. We need you. This city needs you. He left. Walsh remained seated. I know I don't deserve to ask you for anything, not after how I treated you, but please consider it. Emma met her eyes. Why do you care? This morning you wanted me fired. Walsh's voice was raw. Because I have been a doctor for 18 years and I have never been more wrong about someone. You are a better trauma surgeon than anyone in this hospital. Better than me, certainly. She paused. And because watching you work today reminded me why I became a doctor in the first place. You didn't just save patients. You made us all better by being here. Webb struggled to his feet. I need to get back to my gurney before they sedate me. But Commander, one more thing. Emma looked at him. You saved 115 soldiers. You lost 1. That's a 99% success rate in the worst possible conditions. His voice was firm. The Army gave you medals for valor, but you've been punishing yourself for not being perfect." He moved toward the door. "David wouldn't want that. He'd want you saving lives. It's time to forgive yourself." The door closed behind him. Emma and Walsh sat in silence. Finally, Emma spoke. "The little girl from earlier, patient C, is she okay?" Walsh nodded. "Stable. Recovery. The resident you supervised did excellent work under your guidance." "I want to see her." They walked to pediatric recovery together. The little girl was awake, bandaged but alive. Dark hair spread on the pillow, eyes bright. A woman sat beside the bed, the mother. She looked up when they entered. "Are you the doctor who saved Maria?" Emma hesitated. "I helped, yes." The mother stood, grabbed Emma's hands. "Thank you. Thank you so much. They told me she almost didn't make it." Maria looked at Emma. "You're the nice lady who fixed me. Mommy said you're a hero." She held out a piece of paper, crayon drawing, stick figure doctor with angel wings. Emma took it, stared at it. Something broke inside her chest, not breaking apart, breaking open. Tears flowed, silent, unstoppable. "I'm not a hero, sweetie," Maria smiled. "Yes, you are. You saved me." Emma knelt beside the bed, still holding the drawing. "You know what? You're very brave. You're going to be okay. Because you fixed me." Emma nodded, couldn't speak. Walsh touched her shoulder gently. "We should let her rest." They walked back to the break room in silence. Emma looked at the drawing, at the folder with the job offer, at Walsh. "I'll read it. The offer. I'll think about it." Walsh smiled, small but genuine. "That's all I can ask. And Emma, whatever you decide, I'm sorry, truly, for everything." Emma nodded, walked to her locker, got her things. The drawing went carefully into her bag. First thing in 4 years that felt like hope. Small, fragile, but real. She looked at her hands one more time. Steady now. Maybe Webb was right. Maybe she'd just been waiting for the right reason to come back. 3 days later, Emma stood outside the hospital, civilian clothes, the folder in her hands. She'd read it 17 times, every word, every clause, every promise. Now she just needed to walk through the doors. Her feet wouldn't move. Someone cleared their throat behind her. Walsh, white coat, coffee in each hand. She offered one to Emma. "I had a feeling you'd be here early." Emma took the coffee. "How'd you know I'd come?" "Because you're not someone who runs from hard things. You're someone who runs toward them." Walsh sipped her coffee. "You just forgot that for a while." They stood in silence. "I have one condition," Emma said finally. "Name it." "Every paramedic, every EMT who brings patients here, they get treated with respect." Emma's voice was firm. "You never know who they used to be, who they still are underneath. No more assumptions, no more dismissals." Walsh extended her hand. "Deal, and I promise, never again." Emma shook it, smiled, first real smile in the entire story. "Then I'll take the position." 2 weeks later, Emma stood at the front of the conference room, white coat, MD credentials restored and visible, her name embroidered clearly. Dr. Emma Rodriguez, trauma surgery consultant. The entire ER staff packed the room, residents, attendings, nurses, paramedics. She'd prepared a presentation on combat triage protocols, slides, statistics, procedures. Her hands were steady on the laser pointer. In combat zones, you have seconds, not minutes. The golden hour becomes the golden minute. Everything you know about standard protocols gets compressed. She clicked to the next slide. "Today, I'm going to teach you how to think like a combat surgeon, how to triage 40 patients simultaneously, how to make impossible decisions under fire." The residents leaned forward, taking notes, asking questions. Emma answered each one, confident, authoritative, alive. Walsh watched from the doorway, nodding approval. After the session, staff members approached. The young resident from the bridge collapsed. "Dr. Rodriguez, I wanted to apologize. I misjudged you that day. I'm sorry. Thank you for staying." The nursing supervisor who'd threatened to file complaints. "You're the best thing that's happened to this ER. I was wrong about you." Emma accepted each apology with grace. No bitterness, no holding grudges, just moving forward. The doors opened. Webb walked in, fully healed now, little girl holding his hand. "Commander, this is Sarah, the daughter I lived to meet because of you." Sarah looked up at Emma, smiled, ran forward and hugged her legs. Emma knelt down, hugged her back. "Your daddy is very brave." He says you're braver. Emma's eyes met Webb's over Sarah's head. We're both just doing our jobs. No, ma'am, Webb said. We're both doing what we were meant to do. 1 month later, Emma stood in the scrub room, surgical cap, mask, sterile technique, her first elective surgery since David's death. Scheduled trauma repair, non-emergency, planned, controlled. Walsh scrubbed in beside her. You ready? Emma looked at the instrument tray through the window. Scalpels, forceps, clamps. Her hands hovered over the tray. Moment of hesitation, old fear rising. She picked up the scalpel. Her hand was perfectly steady. I'm ready. They entered the OR together. Patient prepped, anesthetized, draped. Emma positioned herself. Scalpel to skin. The blade moved. Clean incision. Precise. Perfect. She was back. Really back. Walsh's eyes met hers over their masks. Unspoken understanding. Pride. Respect. The surgery took 2 hours. Flawless. When Emma stripped off her gloves in the scrub room afterward, her hands were still steady. Walsh smiled. Welcome back, Dr. Rodriguez. 6 months later, the hospital lobby gleamed with new signage. Level 1 Trauma Center, certified. Emma's protocols had been adopted statewide. Other hospitals implementing her systems. Training programs spreading. She walked through the ER. Her team had grown. 8 doctors, 15 nurses, all trained in her methods. A plaque hung on the wall near Trauma 1. In honor of Commander Emma Rodriguez, MD, where everyone comes home. Emma stopped to read it. Still felt surreal. Her pager went off. She smiled, headed toward the trauma bay. But first, a detour, the ambulance bay. A young paramedic sat alone on the bumper, head down, shoulders shaking. Emma recognized the posture. She sat down beside her. Rough call? The paramedic nodded, tears streaming. I couldn't save him. Tried everything. I just don't know if I can do this anymore. Emma put a hand on her shoulder. I know that feeling, better than you think. The paramedic looked up. You're Dr. Rodriguez. You save everyone. No, I don't. Emma's voice was gentle. I lost someone once. Someone who mattered more than anything, and it almost destroyed me. She paused. But you being here, trying, caring enough that it hurts, that matters. The paramedic wiped her eyes. How do you keep going? You find your way back, and sometimes others help you find it. Emma stood, extended her hand. Come on, I'll show you something. They walked into the ER together. Emma pointed at the organized chaos, the efficient teams, the lives being saved. This is what we built, from trauma, from loss, from failure. She looked at the young paramedic. You don't have to be perfect. You just have to keep trying. Her pager went off again. Mass casualty incoming, multi-vehicle accident, the familiar surge of adrenaline. But no fear this time, just purpose. Stay with me today. Watch how we do this. The paramedic nodded. They walked to the trauma bay together. Emma in her white coat, head high, hands steady, ready. The automatic doors opened. Gurneys flooded in. Emma's team mobilized instantly. Smooth, coordinated, perfect. She'd built this. From ashes and grief and 4 years of running, she'd found her way back. The doors closed behind them. Inside, Emma was already moving, calling orders, saving lives, doing what she was meant to do. The screen faded. Text appeared. Dr. Emma Rodriguez continues to serve as Chief of Trauma Services at Metropolitan General Hospital. She has trained over 200 medical professionals in combat-grade emergency medicine. Her protocols have been adopted by 47 hospitals across 6 states. She has saved countless lives since returning to surgery, and she has never stopped fighting for those who fight to save others. The end.